My name is Jessica Maxwell. I grew up on the east coast of Canada, and I did my undergraduate degree in psychology at Dalhousie University. I did my medical school at Memorial University in Newfoundland, and then I moved to Kingston, Ontario to do my general surgery residency at Queen's University. I then went on to do a fellowship in breast surgical oncology at the University of Toronto, and then I did a second fellowship in ablative and reconstructive breast surgery at the University of Western Ontario. I've always been interested in medicine, and I was lucky enough in high school to be able to shadow some physicians and nurses at my local hospital. From there, that interest kind of snowballed, and as I got further along in my academic career, I realized that I was really interested in surgery. I liked the idea of working with my hands. I liked the immediacy of general surgery. While I was in my general surgery residency, I realized that I really enjoyed working with breast cancer patients. I liked dealing with the problems that they face. I liked working with that patient population, and I liked the surgeries that I was able to do in the operating room. My specialty is breast oncology, so I treat breast cancer, but I also treat benign breast disease or non-cancerous breast disease. I see high-risk patients who don't necessarily have cancer, but are at a higher risk than the general population of developing a breast cancer. And my special interest is oncoplastic breast surgery, which is a combination of breast surgical oncology, standard operations to remove the tumor, as well as some plastic surgery techniques so that we work with the patient and with their body type and their tissue to give them the best possible aesthetic outcome at the end of the case. I really enjoy working in an academic medical center because I've always been really interested in teaching young physicians and medical students. I think that's a really important aspect that appealed to me about academic medicine. I was the beneficiary of an academic medical center as I went up through that system in my training. I also think academic medical centers offer some cutting-edge treatments, and we're sometimes pushing the envelope with research, which is, I think, really important to offer the newest and best care for our patients. When I first meet a patient, my goal is to understand where they're coming from and what their goals are for the meeting. A lot of times they're very stressed and very anxious because going through the process of being diagnosed and treated for breast cancer is a stressful situation. So I think one of the main things I try to do is understand what they're expecting to get out of the meeting. As well, I want to make sure that they understand why I'm doing what I'm doing, why we're making the recommendations we're making, why we're ordering the tests that we're ordering, so that they don't feel in the dark at all about the situation. I think understanding what's going on and being a part of that situation, a part of the team in the decision-making process, really goes a long way to alleviating some of the anxiety that comes along with this diagnosis. So my goal is to try and really understand where they're coming from and to take away some of the anxiety and make the process a little bit easier if I can.